Natural Solutions with Dr. J, your source for time-tested and cutting-edge natural medicine approaches to optimize your health. With your host, Dr. J. Sordean. So, it's great to have an opportunity to have you on this podcast. So it's Dr. Frank Lucido, and you have been in practice in Berkeley here for many years. I think we met years ago. I've been here since '83.
Yeah, I started here in December 1979.
Wow!
Yeah.
Wow, fantastic. And are you a native of this area?
No, I moved out here in 1974, right after medical school. I'm from Michigan originally.
Oh, that's what I was thinking.
Yeah.
So that was University of Michigan, or?
I went there for undergrad and medical school.
Oh, fantastic.
So I lived all my life in Michigan until I finished medical school, and I came out to San Francisco to do my internship and family practice residency.
Okay. And that was where? At UCSF? Or?
Well, the internship was at French Hospital, which was a small private hospital in San Francisco. It's now part of Kaiser. It was one of the last rotating internships there existed. And then I did a family practice residency in Martinez at the county hospital through UC Davis.
Oh, interesting. Very interesting. And then, so did you start out just opening your own practice right after that, once you got licensed and all?
No, I didn't feel, I wasn't sure where I wanted to be and what I wanted to do exactly. So I did emergency room work for about 2.5 years.
Oh, fantastic.
And, traveled around the state doing that.
Oh, interesting. Yeah, when I first moved out here before my practice was going, I had been doing Japanese translation of cancer for National Cancer Institute. I moved from Philadelphia. Mm-hmm. And then when I was getting practice going and getting licensed, I worked at Alta Bates ER as an intake clerk for a while, for about a year. So I know something about emergency rooms in this area. But that's fascinating. I didn't know you had that background in emergency room stuff. That's fantastic. And then so after that, then you went into...
Then I started here in 1979, took over an existing practice, and from a doctor that was retiring, and been pretty much doing that for 37 years now.
Wow, amazing. That's great. So you have years and years of clinical experience,
right,
with lots of different kinds of patients,
right,
as a family practitioner. So is that also pediatrics, though? I mean, it used to be that.
I used to do all ages and deliver babies even. But in the last 10 years, I don't see kids under 12 for my general practice because it's hard to keep up on all the immunizations.
Right.
And I'm in a call group of 12 others, and so none of us are seeing kids under 12 for general practice, although for my cannabis practice, I'm seeing all ages because I don't have to be the pediatrician and the neurologist since they already have a pediatrician and a neurologist.
Interesting.
So I've seen about 100 kids with seizure disorder and or autism.
Wow.
For cannabis evaluations.
Wow,
Yeah.
that is so fascinating. Well, let's sort of jump into that then.
Yeah.
So you are also getting referrals from that group of 12 too,
Right.
or something? Or?
Well, from that group of 100 parents, 100 sets of parents, and also from some of the local pediatricians and neurologists that need some help with the seizures, because there's a number of seizure medicines that these kids are on, and all of them have terrible side effects, and some of them work to some extent, but cannabis works as well as any of them with much fewer side effects.
Very interesting, very interesting. So what are some of the medications that cannabis is equal or more effective because of side effects, etc.?
Well, you're seeing some of the old standbys like Dilantin and Phenobarb, which are used less and less, but those are still used, so cannabis seems to be as effective as those for these kind of seizures that these kids have. And then there's clobazam, there's a series of about 10 different, 20 different medications these kids can be on.
Wow.
And sometimes they're on 4 or 5 of them.
Wow. Well,
so often they could take less of these medications. Sometimes they could go completely off of them.
Oh, interesting. Interesting.
And of course, since I'm not a pediatrician or neurologist, I always make sure that they're still following up with their doctor. They don't stop any of the medicines that they are taking without letting their doctor know.
Yeah. So and what's the longest you've worked with any particular child with seizures so far using cannabis?
Probably this part of my practice, even though cannabis has been the law, medical cannabis, for 20 years now. In November, it'll be 20 years that we've had our Prop 215 law. As far as my seeing a lot more kids, that's been about the last 5 years or so.
Oh, interesting.
Started off with a few and referred more.
Because of the success that you've been having with.
Yeah.
Yeah.
Yeah. And not too many of the doctors feel comfortable seeing kids. Certainly the ones that I complain about are the mills that are seeing a lot of people at the drop of a hat for in their 3 to 5 minute evaluation.
These are cannabis or doctors who prescribe cannabis.
Right.
Right.
Yeah. Some of the what I call the mills, the chains that really are a little bit of an embarrassment to the whole system. I mean, I'm supportive of adult use, and I hope the ballot initiative ALMA passes in November, and because it really should be an over-the-counter medicine for adults.
Oh, right.
And but for under 21, we're still going to need Prop 215 will still be protected under that law.
I see. And, interesting. Okay, so that's the people who are minors under 21.
Right.
So that law, Prop 215, will still help to cover that arena. Very interesting. So, so you talked about seizure disorders. There's particular ones where you find that it's most effective?
Well, the group of kids that I'm seeing, this 100 kids, not a homogeneous group of kids. There's probably about 60 diagnoses among that.
Oh, interesting.
So the autism and or seizure, most of them have both.
Oh.
So there's a lot of some of them are genetic defects, chromosome deletions, etc.
And those are things that are actually studied. There's like chromosomal testing that's been done so that people know that that's one of the underlying.
Right.
Oh, interesting.
Yeah.
Interesting. Do you do that kind of chromosomal testing, or is it usually the pediatrician or the neurologist or something?
The pediatrician or neurologist have already been following those kids, have diagnosed those kids.
So chromosomal testing is becoming more and more mainstream as far as that arena goes.
Right.
Oh, interesting.
Yeah.
That's great to know.
Yeah.
So when you're working with them, you have a diagnosis already. It's in a particular category. There's 60 different categories of 100 kids as far as the combinations of what's going on. So it's quite a complicated process, quite a complicated condition.
Yeah. It's not one homogeneous group of kids. So.
And so it's often autism combined with seizures, or is there autism?
Most of them have both. Most of the ones I've seen. Yeah, I have some kids with autism only. I have some kids and adults with seizure disorder only.
Okay.
So, and of course, the autism spectrum can be anything from very severe to milder, like Asperger's.
Right.
So they call it autism spectrum disorder because it's such a wide spectrum.
Right. There's so many different manifestations and ways that somebody could express that particular situation. So, with autism, are there particular mechanisms that have been defined as to how cannabis works as far as seizures go, for example?
Well, I don't know that they know exactly, but I think it does tend to be a modulator of the nervous system. So, and cannabis is, this is a bit complicated. I mean, we're knowing more and more about it, but we have our own endogenous cannabinoids.
Right.
Anandamide and 2-AG. We have cannabinoid receptors. So
and are there a lot of them in the brain, actually? I thought it was one of the largest number of receptors that exist. There was some herbal conference I went to.
We have a lot of receptors in the brain. How many different endogenous cannabinoids, I'm not sure, but there's 2 identified and probably more.
Yeah, there were some herbalists from England and Australia who were talking. They speak for Herb Farm. I think it's Herb Farm, not Herb Farm, but a different one anyway. And they were talking about it at one of their last conferences they had in Berkeley. And they were saying there's so many of those receptors in the brain, and so and the actual mechanism is not completely known. Certain areas are known, but they were saying there's all these cannabinoid analogs and things like that are so important for our brain to function properly. Actually,
that's right.
Yeah. So. That's fascinating. So as far as seizures go, you would say that the different kind of receptors that are in the brain may be regulated more or harmonized more or something, or?
Yeah, I don't know that we know exactly how it works in that sense.
And then as far as the autism spectrum, and do you have some idea of what the mechanism is there for cannabis, or not?
I don't think so. I think I mean, we know that the cannabinoids, bind with certain receptors, and sometimes they competitively inhibit each other. THC and CBD are two of the main cannabinoids that we know about.
So for the audience, not everyone knows what THC means, but
right.
Tetrahydrocannabinol.
Yeah.
And
so THC is the one we all hear about.
Right.
Of the 100 cannabinoids they've identified, THC or tetrahydrocannabinol. The next one we hear about a lot lately is cannabidiol or CBD. And so CBD is non-psychoactive or much less psychoactive. In fact, THC is almost unique in being psychoactive among the 100 cannabinoids.
oh, interesting.
Yeah, the other ones, there may be a few that have some psychoactivity, but much less. So THC is the one we all hear about because that's the one people like recreationally. It's a mood elevator, besides having a lot of other good properties like pain relief. In high doses can be sedating, so it can be a drawback, or it can be the medicinal effect you're looking for. If you don't want the intoxication or sedation that some THC can do, then but you do want the pain relief, you want the seizure control, then you can have something that's more CBD rich and less THC.
Very interesting. So when you are having a diagnosis, you're working with a person to try to figure out what angle, what the goal is to help them. You would then say, okay, I think we need more in this direction of a particular blend or something?
Yeah, basically, if we divide up patients, there's those that are cannabis naive, people that have never used it, and then there's people that have already been using it. So, at first I was seeing adults and exclusively who have already used cannabis and wanted to continue using it. So there was no question that we didn't really know that. I didn't know that much about other cannabinoids. So there wasn't anything to decide other than writing the recommendation, and then they could go get the cannabis or they could grow their own. And then in the last 10 years, we've known about not only known about CBD, but now they're doing testing for CBD. So a lot of the dispensaries will test for THC level, CBD level, CBN, which is maybe more of a breakdown product of cannabis, showing older cannabis, pesticides, and they'll be testing for more things as time goes on. But those are the main things they test for. And at first, THC was the main thing that people cared about, but a lot of people don't like the THC part, because if you like it, it's a euphoric feeling. If you don't like it, it's dysphoric. So some people don't like that feeling.
That's true.
So not only am I seeing cannabis naive patients, but I'm seeing patients that are medically naive, meaning that they used to use it in the 60s or 70s, they got bored with it, or they found they didn't really like it, but now they have something serious and they want to try it again. And often they've heard that there's some less psychoactive strains, and so then I give them my little talk about it. And
that's very
I
interesting.
can give you my little spiel about that.
Sure. You want to get that?
Yeah, so GW Pharmaceuticals is a company in England. They have a product that's not available here, but the information is useful. So I usually give patients a printout of this, or I'll send it to them in an email. And I'm happy to send this to anybody.
And so people listening or watching this, how would they get a hold of that?
Just email me at drfrank@drlucido.com.
All right.
Or look at my website, which is drlucido.com. That's drlucido.com.
Very good.
And then I'll have how to contact us. So this is in a nutshell what I tell people. So CBD and THC are two of about 100 cannabinoids they've identified. THC is the one I'll hear about. It's the one people use, recreationally, but so GW Pharmaceuticals has a product that's not available here, but the information is useful. It's called Sativex. It's a 50-50.
How do you spell that?
SATIVEX.
Sativex. All right. Like sativa.
Yeah.
Right.
And then VEX. And it's a sublingual spray available in Canada and Europe, but not here. And so they wrote a paper called A Tale of Two Cannabinoids, the rationale for mixing THC and CBD. And the salient sentence in the abstract, which is that paragraph at the beginning of a scholarly article, says this: CBD has been shown to diminish some unwanted side effects of THC, including intoxication, sedation, and tachycardia. So there's less of that,
Right.
while still having pain-relieving properties, anti-nausea properties, and anti-cancer properties in its own right. So it's not necessarily better at those things, but because there's less intoxication, sedation, and tachycardia, you can get higher doses.
Higher compliance too, or?
Well, higher doses of it without getting intoxicated or sedated,
Right. Oh, interesting.
which is a limiting step there. So if you've got kids that you want to treat seizures, sometimes you have to use huge doses of CBD, whereas if you use a comparable dose of THC, they'd be too sleepy or intoxicated. Fortunately, no one's ever died from an overdose of cannabis, so that's good information. But if you're sleepy all the time, that's not useful, or if you're intoxicated. So it's nice to know that when you're not interested in that, because sometimes that is the medicinal effect you're looking for, some sedation, some mood elevation. If you're not looking for that, that would be a limiting step, because with seizure disorder, sometimes you need huge amounts, and you can get that with the CBD when it has, when it's a 20-to-1 ratio or a 30-to-1 ratio of CBD to THC. You get higher doses and still function.
So is GW Pharmaceutical?
GW Pharmaceuticals is a particular company I'm talking about in England,
Yeah.
but there are a number of...
And so they take the ingredients and they extract it or something, and then they put it in back in combination in some ratio.
So they have some strains that are almost all CBD, some strains that are almost all THC, and then they blend them so that they get a consistent product. What they're also studying in this country, but isn't on the market yet, is Pedialex or Epidiolex. I'm not sure how they pronounce it, but it's a CBD only, or very 30-to-1 or almost all CBD, and it's being studied at UC San Francisco by neurologists there, and New York University, and maybe one other university. But they're limiting it to 2 of the kinds of kids that I see. So it's Dravet syndrome and Lennox-Gastaut, which are 2 types of seizure disorder and/or autism. And I've seen some of those kids, of those type of kids, but they're not on that program. They're seeing me for cannabis because not everybody is accepted to that program.
I see. Oh, that's very interesting. So you aren't part of that research study?
No. But I've talked to Dr. Sullivan, who's part of that study, and we have some patients in common.
So you've mentioned a variety of different